This is truly the poetry of presentation formats. Good ideas distilled to their essence. So sit back, focus your minds, and enjoy the ride. So our final speaker is Taylor Bassingthwaite. She's been practicing as a change agent since grade 2 when she was first told, "You can't because you're a girl. Get in the other line." From times of study and research, she found a place within HQC, excited by an organization whose formal arrangement is to support improvement beyond the status quo. Welcome 2 years ago on secondment into the Prince Albert Parkland Health Region, she witnesses daily with this team of teams, it is not possible, it is happening. She's a proud mama bear to Sadie, Max, and Ruby, and proud partner of an inspired educator. Taylor?
It is time for all the heroes to go home, if they have any. Time for all us commoners to locate ourselves by the real things we live by, the poet Stafford wrote. I offer here simply a perspective in a time to reflect on where we commoners are in the most uncommon of pursuits. 30 years from now, I will tell the people I love most that I tried. Like many of you, there's someone I wear in my mind, little Chaz man there, a frequent user since 6 months of age of healthcare systems. I carry his experience and those experiences of all who love him to keep my feet moving in a direction when I never ever arrive at a destination. So what is possible? I immediately thought nothing is impossible, yet drawn to what is necessary now. For my Chaz and yours, what's necessary? The person comes first in action and word, no waits, care processes are effective and efficient, access every time for everyone, and that every individual knows they can expect the same level of care. A Haitian prayer. Lord, there is a big devil called discouragement. We ask you to send him away because he is bothering us. Where do you locate yourself on this curve tonight? About 8 months ago, I was well at the bottom. So, moving from doubt to faith to some level of determination, I threw it out to the universe and said, whatever you throw back at me, I'll catch it and pay attention. So following day, I was given Viktor Frankl's Man's Search for Meaning. A girlfriend mentioned the book in passing, and my mom, without any notice from me, suggested rereading Viktor Frankl's book she'd given me 15 years ago. Frankl, a survivor of the Holocaust, number 119,104, wrote of his experience in camps. The messages are clearly many. This reading choice is what I took away. What is possible, probable, well, we choose and then make it so. Frankl said everything can be taken from a man but one thing, to choose one's attitude in any given set of circumstances. So I took that and started to reflect. Collectively, we've made many choices. Forefront in my mind this moment are making a formal shift to it's going to be patient first, and the ideas are going to come from the experts closest to the patient, making it Gemba first. 2009, 5 years ago already, many who are here tonight sat in this room collectively trying to agree upon who is it we are in service of, who is our customer. This moment in time stands out to me because of Doug Eby. After hanging back in that corner for 2 days, listening to our conversations, he asked, "You're all doing your own thing. Do your patients care about these lines? Are you a system?" And the people in the room decided we are a system. Let's try something together. And in the trying something uncommon yet possible, we now walk where there is little certainty, few guarantees, little safety, little black or white. Yet we find the red, the possibility at the edge, the possibility to do the impossible. The edge, the red that is crazy, ridiculous, irrational, stormy, chaotic, never gonna work, catastrophic, what if thinking, I can't, you can't, we can't, I'm out of here kind of crazy making. This edge, it seems, historically at least, is in fact the only place where the real things lie, where change has ever been. Imagine if those in their moments of history took a safe truth that some are less than people or deserving of other status. The red are those who years later say, yes, it was that way, and here's what we tried. Social movements, what's the link to complex healthcare? While many models exist, Cotter and Moyer both describe 8 stages that share a view. Urgency, trust, real relationships, simple vision, clear stats, heartfelt, authentic people, and the best cases have heavy doses of empowerment. Change leaders don't let up in nurturing culture, both in low curve moment where people feel powerless and failure. Powerful narratives are created that tell another option for us to choose. Both social movements and large-scale change point to the shift up from the bottom as connected to the stories we tell, the narratives we share with ourselves and each other, whereby creating how we feel about the situation. I ask you what stories you've heard today. Mr. Narita-san, our sensei, I asked him recently when he was having dinner at our place, so it's been about a year, how are we doing? And he said, you've got a good understanding of skills and tools, now you must develop your people. He said, at Toyota, we don't build cars, we build people. Well, then I said, well, we're doing pretty good considering it's only year 2 of 15. And looking at me, smiling, he asked, what is 15? And I was like, well, I've been a quality improvement consultant for 7 years, so I got this. And I said, well, in high-performing healthcare systems, we often see transformative change in 10 to 15, yada, yada, yada. And he gets that grandpa smile on his face that he always gets when I'm about to be schooled. And he says, Taylor, son, it's not year 2 of 15, it's year 2 of forever. Forever, daunting. No destination, only direction. Develop people. How? Again, to commonalities in social movements and large-scale change models. Self-awareness, being our genuine, authentic selves. Commitment to the whole with compassion and passion. Having each other's back. Common purpose. And my favorite of all, controversy with civility. A key principle for success. Any group on the edge are going to have differences if we're lucky. And how wonderful. Edward Deming, granddaddy of quality to Japan, as I'm sure many of you know. His wisdom always shared a special call for formal leaders to lead new work in new ways. Before his death at one of his last lectures, he asked us to consider, where are the leaders going to come from? Of all his 14 points for the ABCs of management, he highlights as foundational that leadership must nurture culture change by driving out that fear. One of the finest nurse unit managers I know, people I know, leads this way by living her values in daily ways of being in the world. Perhaps sensing my discouragement at a meeting recently, the next time I saw her, she produced a paperback from her pocket. I smiled and cracked the spine. I'd been given this book twice this month and figured it was probably time to read it. I share its message with you here. From the elders of the Hopi Nation, to my fellow swimmers, here is a river flowing now very fast. It is so great and swift that there are those who will be afraid, who will try to hold on to the shore. They are being torn apart and will suffer greatly. Know that the river has its destination. The elders say we must let go of the shore, push off into the middle of the river and keep our heads above water. And I say, see who is there with you and celebrate. At this time in history, we are to take nothing personally, least of all ourselves, for the moment we do, our growth and journey stop. The time of the lone wolf is over. Gather yourselves, banish the word struggle from your attitude and vocabulary. All that we do now must be done in a manner and in a celebration, for we are the ones we've been waiting for.